TOFIQ was established in 2012 by Iraqi American academics and professionals, the diaspora of Iraq in the United States. And we hope TOFIQ, with others, to support the recovery of Iraq in higher education, science, and all the walks of life. Our objective here is to address what TOFIQ members and others in Mahjar can offer to help in the health crisis of the internally displaced people in Iraq. The conference, we have two panels, one on the importance of diaspora in Mahjar in help rebuilding their home countries. The other is on humanitarian aid to Iraqi IPDs. TOFIQ's long-term objectives to utilize the knowledge and experience and talents among members and beyond to help in reforming education, research, and development in Iraq. And in conclusion, we go to Benjamin Franklin's statement, well done is better than well said, and we hope we will do more than we say.
The crises we face in Iraq are many. What needs to take place, I don't think we will disagree on that. What work can be contributed, I think we will all agree on that. TOFIQ should help us in the strategic dimension, in saying who are able to help, when they are able to help, what type of help, or whether they are officials in the Iraqi government. Here we need to work together.
Iraq was faced not with one, but two crises in the last 12 months. Not just ISIS, which came in and tore apart a third of the country, but an extraordinary collapse in the oil prices, and now it is coming back dramatically, as we're watching tonight.
I'm Adil Shamu, and I'm moderating Panel 1, the role of diaspora in rebuilding their countries of origin. Ms. Sonia Plaza, she's a senior economist at the World Bank and on mobilizing diaspora resources as agents of social and economic change, but she hasn't showed up. And Dr. Jennifer Brinkerhoff, she's a professor of public administration and international affairs at George Washington University and a leading figure in that area.
Diasporans occupy the in-between space of being from the inside, but also from the outside. So, because you are both Iraqi and now American, you see both sides of the story. And so if you feel that pull from both places, then that would mean you're diaspora. Diasporans may actually have a significant comparative advantage as institutional entrepreneurs. Diasporans can bring that no other actor can bring to try to resolve this challenge. One of the big challenges is if you're sitting within an existing institutional system, it's really hard to think outside of the box. So why would somebody in that context say, but now we should do something different? You're rooted in this system, it's hard to see alternatives outside of it. But if people believe, if they truly own a change, then they are more likely to commit to it and to see it through. How can we initiate these processes where people do begin to believe that there are alternative ways of thinking, believing, behaving, etc.?
It is my pleasure to introduce these three gentlemen and lady in a panel on supporting internally displaced peoples within Iraq. Mr. Manuel Clenard, who's with Medicine Sans Frontières. It is a Doctors Without Borders group. Ms. Ivana Vuko, who's with USAID. And sitting next to me is Mr. Francois Stem, who's with the International Committee of the Red Cross.
MSF has been working in Iraq permanently for the last 10 years. 4 ways to intervene for IDPs in Iraq today, that with mobile clinics to provide primary health care and sexual and reproductive health, have a very strong focus on mental health, provide the drugs and pay extra hours for the staff.
Was to provide a quick assistance to people to survive the winter, to provide quick shelter fixes, to find ways to give people plastic sheeting so that they can isolate the spaces where they are and heat them. Also that people actually needed access to water, they needed sanitation, they needed to bathe, they needed to cook, they needed to drink. is their access to safety.
Iraq is currently the fourth largest operation of the ICRC. We work in 17 out of the 18 provinces, out of 10 field offices. We do provide monthly food rations and other relief items, blankets, winter clothing, also life-saving medical and surgical supplies. We also treat a number of persons, 2,600 recently, persons with disabilities.
Go back to March 2009, when we had that fascinating, I've never, ever, I've been in this country, I want you to know, for 57 years. I've never, ever thought Iraqi will, no matter how developed they are, no matter how organized they are, will have such a fascinating, very impressive conference.